PKO. We're just here to support.
Great. Well, why don't I do this, Mr. County Executive, Madam AO? Let's do quick introductions before Mr. County Executive makes his comments, and then we'll jump right into the questions, just so you know who's out there. But I'll do a formal welcome. So good afternoon. I'm Terry Hickey, the Deputy Director at Health and Human Services for Housing and Community Development. And I'm welcoming you to the second of 3 listening sessions that are being held by the Economic Recovery Subcabinet, really, literally to listen and hear what you think about what's going on in the county related to recovery from the COVID-19 pandemic, what we need to learn, what we can learn through all of you. This panel has been specifically recruited because you're out there in the community working with individuals and families. And we believe that an essential part of economic recovery is reaching down to the individual and family level and finding out where the gaps are, what's still needed, and what we can do. And I believe our county executive will be talking in a couple of minutes about the initiatives we are already underway on, but we know there's so much more that we need to be keeping top of mind. So with that in mind, if we could do quick introductions, sort of who you are and who you represent. And Mike, I met you first. Why don't we start with you?
All right. Thank you very much. I'm Mike Bullis, Executive Director of the Image Center for People with Disabilities. We're out in Towson on Joppa Road at Hampton Plaza. We're a center for independent living. We are people with disabilities ourselves and are helping people with disabilities live in the community and meet the challenges of the COVID environment right now, get the shots in the arms, lots of vulnerable folks who need assistance. So with me, just to break the chain a little bit because it makes more sense, is Cheryl Grossman. Cheryl is our accessible vaccine response coordinator. So Cheryl Grossman, say hello and anything about yourself you want to tell us.
Well, this is Cheryl Grossman. Like Mike said, I work for Image Center, helping with Baltimore City, Baltimore County, and Harford County accessible, equitable vaccine response, but it's a little bit more broader than that in COVID response. So thank you. I'm very honored to be here with you.
All right. Well, welcome, Mike. Welcome, Cheryl. Amy, why don't you introduce yourself?
Hi, I'm Amy Post. I'm with the Family Crisis Center of Baltimore County. We have a mission to prevent and interrupt cycles of violence for family members so that they can move forward.
Excellent. And I see Lena. Hi, Lena. Oh, I think you need to unmute.
Wait, always. Hi, I am Lena Polite. Thank you for the invitation. I am representing the Baltimore County branch of the NAACP, and I serve as their education chair.
Great. Thank you so much for being here. And I see Matthew with Esperanza Center. Hi.
Hi, great to be here. Thanks for having me. Esperanza Center is a comprehensive immigration services center. We're part of Catholic Charities of Baltimore. We're headquartered in Fells Point, but our client reach is heavily Baltimore County, Baltimore City, almost a 50-50 split. And I myself, I'm director, been here since January of last year, and been a full COVID year, but we're really proud of the work we've done with the community and during COVID, and look forward to working with you all.
Fantastic. Thank you for being here. Megan, hi, good afternoon.
Good afternoon, everyone. My name is Megan Goffney with the Community Assistance Network. I'm the deputy director there, and we do a lot. I call us the OneStop Shop for food pantry, homeless shelters, housing programs, eviction prevention help. So we do a lot to help people remove barriers and self-sustain.
Great. Welcome. I see another colleague. Hi, Michelle.
Good afternoon, Terry and everyone. Can you hear me? I just heard an interesting beep.
Yep, we can hear you. Yeah.
Okay, great. Thanks. Thanks so much for having me. My name is Michelle Beto Jackson, and I'm with the Y in Central Maryland. And obviously we service Baltimore City and the 5 surrounding counties. I work in Baltimore City, includes 2 full service Ys and 2 partnership Ys with the Baltimore County Office of Recreation and Parks. We also are the sole source Head Start delegate, and we are just recently partnering to do some community school work in the county. So again, honored to be here, and thank you so much for the invitation.
Great, thank you for being here. And then there's 2 other panelists, Dr. Ed Torrey from the Islamic Society of Baltimore that I think will be joining us soon, And also, I know he's feeling a little under the weather. We're not sure if he can join us, but Mike Netzer with CCBC. So when those folks jump on, if they make it, we'll introduce them or have them introduce themselves then. I do want to recognize again that there's an audience out there watching on social media, YouTube and cable TV, watching, and some folks have already sent in their own thoughts that we can address later on the call. We have our Administrative Officer, Stacy Rogers. Thank you very much for joining us. Just wanted to acknowledge you before we go on to the County Executive's comments.
Thank you, Chair.
And, you know, this is an overused saying when you say somebody doesn't need an introduction, but I think in some ways our county executive, John Ushevsky, doesn't need an introduction because he's been so incredibly involved with our nonprofit community. The whole existence of this subcabinet on economic recovery really came from his intense belief and desire that we need to really meet people where they are during such a volatile historic events, but also not just provide people what they need to get back to where they were, but to use this as an opportunity to provide the supports and opportunities to allow people to get ahead. We've noted, I think it's interesting, I sat in on the business version of this in economics, and we've often talked about businesses pivoting and being innovative and coming back better, but I really think we can talk about people in the same way. And how can we support our fellow county residents while also providing them with opportunities to come back even better than they were. And so the person I get that inspiration from is our county executive. So Mr. CE, I'd love to turn it over to you and hear a little bit about what the county's doing in this time.
Thanks, Terry. And I want to thank you, Administrative Officer Rogers, and the entire Baltimore County team for their efforts in this trying time. It's so great to see so many of you, our panelists, and everyone watching. Thanks for your leadership and partnership as we start to think about what our next steps in recovery looks like. I really, truly thank you, each and every one of you, for being here. I apologize in advance that I've been triple booked these couple of days, so I will not be able to stay on for the entirety of the conversation, but wanted to come personally to just say how important it is that we all are here together and planning for recovery to do that together. Because we know that recovery works best when it's done in partnership. And so we look forward to doing that as we chart our course ahead. It's certainly been what has led to the successes we've seen to date. And it's hard to believe that it's been just over a year ago since we started down this road together. You know, just recently we marked the 1-year anniversary of our first resident lost to the COVID-19 virus. Since then, we've lost over 1,300 neighbors and loved ones. Many thousands of residents have lost jobs or their businesses. We've seen over 245,000 unemployment insurance claims in Baltimore County alone. And we all know in our respective roles in government and the nonprofit and faith sectors that this crisis has caused immense needs for our communities. And so that we know in local government, we have an obligation to help meet those basic needs. And that's been our primary focus since we started. In collaboration with our school system, with our library, other folks like the Maryland Food Bank, H&S Bakery, and our local farmers, we've now distributed over 16 million meals to date. And we are obviously looking at food distribution to continue into smaller programs with support of nonprofits to address food insecurity. We know that's not going away. We've stepped up our eviction prevention programs, which have already gotten over $5 million out the door to help 1,400 families stay in their homes. We also are looking forward to drawing upon a $25 million grant from the U.S. Treasury Department to expand that work, keeping a roof over the heads of more families. We've also worked to close the digital divide, providing 6 months of Comcast Internet Essentials to 11,000 different households. And as we recover, we're going to be looking to do more on the digital divide for seniors and other residents. We know that childcare has become an issue through this crisis. So we actually created a program to help our low-income families pay for childcare, especially those who had school-age children who were engaged in remote learning all year, creating a similar program for county employees. We want to make sure that you know we are doing all that we can to help get our neighbors to the other side of this crisis. Same thing with businesses. We've extended our support there as well, awarding almost 1,400 grants across 6 different programs for a total of $21 million. We've helped nearly 300 small businesses install equipment through our Small Business Reimbursement Grant Program, over $4 million to our small business relief grant program, and proud to say that over half of all of our awards have been given to minority and women-owned firms. You know, we are also now at a place where we're starting to see the light at the end of the tunnel, with over 30% of our population partially vaccinated and over 16% fully vaccinated. It gives us some sense that we're starting a gradual return to our normal way of life, and we're making that transition from responding to COVID to recovering from it. But as we rebuild, we're looking at this moment as not just a chance to get back to where we were, but how do we actually improve on what was for our economy, for our service to our residents. We want this recovery to be holistic. And so we want to target resources to businesses and individuals, organizations that were hardest hit, and where we can do the most good. We know that particular industries and individuals really bore the brunt of this economic impact and the social impact of the pandemic. So we want to think creatively about how we're supporting them. And we want to say to you, to our panelists, to those watching, all options are on the table. And we want to make sure that we're resolving to come back stronger with family supporting programs, family supporting jobs, building on some of our great accomplishments to date, like Job Connector, College Promise Program, and the work that so many of our agencies are doing. So we're currently in the midst of budget preparations, and thanks to our federal congressional delegation, we are expecting about $150 million of direct aid. And your input will be critical as we develop our budget and these plans for recovery. So to that end, this is really about hearing from you today. Our team is here to listen about where we should focus our resources, what gaps you see out there, and what innovative ideas you would want to bring to the table that we might not be thinking about. Because as I said, recovery is done best in partnership, and it really does take all of us working together. So with that, thank you again for that partnership. I look forward to planning for our recovery together. And with that, I will turn things back over to you, Terry, to lead this conversation. Again, I'm sorry I can't stay for the duration, but I really appreciate your partnership in this work, everybody. Thanks.
Right. Thank you, Mr. CE. So we have a really simple process today, the way we're going to play this out. There are 4 questions that we kept very broad on purpose. They're meant to pull as much information out of all of you that we can while we've got you here. And I'm going to go through each of the 4 questions, and then we're going to go in order. We'll go front and back in reverse order, and we'll mix it around a little bit. So I'll call you out. We don't have a specific time frame, but we do have about an hour scheduled. We won't go longer if we don't have to. We certainly won't go longer, but we will go shorter if everybody's had their say, and we'll make best use of your time. So a little heads up, I'm going to start with Megan Goffney. She is first on my list. And then we're going to go to Michelle. So just so you have a little heads up. First question is very, very basic, very broad, and I think very important from the standpoint of individuals and families. And the question is, what does recovery from the pandemic mean to your organization and to the communities and the individuals you serve? And to follow up on that, what is a successful recovery going to look like? Mm-hmm. I'll leave it there. So Megan.
All right. I just knew I was going to be first, Terry. Thank you. Recovery to us looks like, and again, we've been doing the work that we're doing now pre-COVID as well. So, we come from the standpoint of, folks that our numbers obviously have increased. The need has increased with COVID, but we have had a group of folks who still were struggling to pay rent, put food on the table as well. So, but in terms of from the pandemic, I would say recovery really looks like just trying to get people's head above water and sustain them, trying to remove the barriers that they face. Every day we get hundreds of calls of people that just need resources, guidance, and a lot of people are coming in, as we know, for the first time that don't know what services are out there. And so we're really just helping folks navigate through that whole system. What it also looks like to us is being able to link people to resources, helping people to helping people to find ways to possibly increase their income. There has been people that have to switch, as professions in this field, especially if they were in the food industry or industry that was really impacted by COVID. So really helping people to maybe think of another career track that will help them sustain, income and increase their income as well. So, and then the last part I would say, Terry, is really the affordable housing piece, I would say. having more resources for affordable housing for people to truly be able to stay in their homes is helpful as well.
Great. And Megan, I want to highlight something you raised. I think we all keep in mind, particularly if you do this work, is a lot of these issues existed pre-COVID.
Yes.
And we have an opportunity to really take a deep dive on those while addressing that whole new population who unfortunately may not have experienced some of these issues before.
Exactly.
Great points.
Absolutely.
Michelle.
So recovery for us at the Y looks like the reconnection. It's the return of connection to people. We are in the people business, and so while it has been universally problematic, it's been problematic to our souls, if you will, to not be able to access people. So that means our children are safely back in programs and not only learning but socializing. It means our seniors are back together and socializing. It means our place of activity becomes that third place again where people can come together and not only address their physical health needs, but their mental and social health needs as well. It also means our associates returning. At the height of this, we had to furlough up to 2,000 associates. And so having them return means that we are in fact recovering from this. And clearly that also plays into the community. We feel when we strengthen within our walls, we are also strengthening communities outside our walls by, again, establishing those reconnections. What will successful recovery look like? Well, we speak a lot in terms of numbers, obviously, because numbers help us meet our mission. It looks like healthy people. It looks like healthy communities. We are seeing not only the physical health, but the mental health hitting all kinds of levels. And so we are hoping by our presence, by our intervention, and by our return, we can help address that space as well. So we are seeing this, the return, a healthy community will look like overall and universal well-being for all, and how we can do our best to support that for all of our communities, quite frankly.
Love that idea of reconnection. And you opened up a point that I want to make sure everybody else feels free to speak about. You all do very altruistic work and you're thinking about your clients, but you mentioned your associates. And I think that even though this is an individual and family listening session, from your perspective, continuing to hear from the panelists about what it takes to help recover on the nonprofit side, you literally are the ones delivering this work, and your health as organizations are directly involved in recovery. So thank you for bringing that up. Mike.
Yes, thank you very much. Boy, when I look ahead to what does wellness look like, what does recovery look like, I keep getting stuck in the present. We've got so many challenges. One of the things that's really going to help us get back together is having people with disabilities in that middle range age, that 18 to 65 range, that are now not classified anywhere in our list of phases, to get them the vaccine. They're just, for some reason, these folks, what people I guess don't know is that people who become disabled, for the most part, it's when they're adults. And although we think of kids and we think of seniors, that's not the big population. So we've got some jurisdictions around the state now who are deciding to just ignore the state guidelines and say, look, adults with disabilities can have access to vaccines. We look forward to a time when everybody gets a vaccine. Right now, the big challenge is those who are who are stuck in their homes, can't get out. People call them homebound. I don't know that I like that term, but people who are stuck in their homes and can't get out, we need a major initiative to get these folks out, or to get out to these folks and get them the vaccine, because they have multiple caregivers who come and go every day. So they're a very vulnerable population. We're losing lives every day. So we want to get people out. And then as we begin recovering, we need to take a hard look at transportation. It's been a challenge, and it continues to become a challenge be a challenge for us. We need 24-hour a day, on-demand, accessible transportation, just like everybody else has, right? When you want an Uber, you call one, but we don't have any accessible Ubers in Baltimore County. We need to get that fixed so that, and maybe it's working through County Ride, somehow standing up a solution that gives people with disabilities that 24-hour access that they need in order to get back out in the community. Cheryl, what else does it look like?
This is Cheryl. Thanks. I think, as has already been mentioned, the dearth of affordable, accessible, integrated housing for folks trying to escape nursing facilities during the height of a rash of COVID infections. They can only leave if they have the services, and part of those services are housing. We already don't have enough. We have long waiting lists of vouchers. And I think I'm really just struck on this term recovery. For some folks with disabilities, it's not really about recovery, it's about getting to a level playing field. If we've struggled for housing and we've struggled for transportation prior to COVID, we're having the same issues now. So I think I take this as the opportunity to fill these gaps, to give us a starting place. So I'd start with housing. I'd start with helping enforce the individualized education plans in county schools. When you go to virtual learning, everybody who's got a plan sort of goes out the window, and to help our folks catch up, or they never will. So I think that's part of where we start.
Cheryl, I want to thank you for really underscoring. It sounded like a weird question to start with, like how do you define recovery? But I think in this space, you hit it on the head. Recovery means something a little bit different, and these are opportunities we don't want to miss. I also have to say, I don't know that you've been told this, but you and Mike make a pretty good team. The back and forth, that's great. Let's go to Amy Post.
Yeah, thanks. I think for us, the experience of the COVID-19 pandemic highlighted the incredible gaps in the housing continuum for victims and survivors of domestic violence. We do a really good job in Baltimore County of emergency sheltering, and then there's this tremendous drop-off for options after that. We know that the folks that we've served face disproportional impacts. A family that's already vulnerable that then loses work, loses childcare, has to couple up with education. And so in order to recover, what we believe is that families impacted by domestic violence need to be able to move from survival to thriving, and that we would see success defined as when basic human needs are not dependent on romantic relationships that aren't functional. And we think that happens 4 ways: through increased accessible, affordable housing, pathways to employment that include workforce development, training and education opportunities, accessible, affordable, safe and healthy childcare, and then effective transportation systems across the county. Right now, to go from where a lot of our services are centered in Dundalk to downtown Towson takes 1 hour and 40 minutes by bus. And if you're schlepping kids in strollers, you're just not going to be able to do that quite so effectively. So that's what we would think about.
Great, thank you. More important structural issues, again, that all date back to before all of this. So we're going to go to Lena and then Matt, and I'm going to warn Matt that we're going to snake backwards. So after Matt answers the question, we're going to go back up the list in the opposite direction. So Matt, you get to answer a question twice, but we'll go to Lena first and then Matt.
You know, what I hear just being on the bottom of the chain in this first question is just the thread of similarity between the organizations on what's important. And so with the NAACP, all of these things are important for us, and they existed prior to the pandemic, which is what everyone I think here is already saying. And those challenges, of course, that are, you know, thread themselves through individuals with disabilities, individuals involved in domestic violence. I mean, it's just a common thread. You know, it impacts, you know, the Black and Brown community as well. And so, you know, these issues, again, were kind of exacerbated by, you know, the pandemic, you know, the access to healthcare, you know, in the community. I think there was, you know, the school board put up a graphic saying, you know, that when you look at the east side of town and the west side of town, is the, you know, the families on the west side of town aren't willing to send their kids back in person. They want to, you know, remain virtual. I think there's that ongoing, you know, this not having that access to healthcare, to affordable housing, those equitable education opportunities, you know, just having, when we talk about recovery, just having all of those, keeping all of those things in mind. And just, you know, when we're determining, you know, recovery, also determining what success looks like, because these things weren't successful prior to the pandemic. And so, you know, again, just having it's that equitable funding for, these type of programs, because we can talk about all of these wonderful things and, what we want. And, when I heard the county executive talk about, the 150 million that's coming, I'm hoping that this money is actually used successfully, to all of these different organizations, and so that the community who needs that intervention can assist or get the assistance they need.
Great. Thank you very much for that. And as promised, Matt, we're going to end this round of question with you.
Awesome. Thank you. So first, access to internet, my sense of recovery is I want to preserve that. I love the idea of thinking of internet more as a utility. I think this year has really, really driven home the need for it. It's modernized lots of our systems. Certainly at Esperanza Center, we've taken advantage of the moment and modernized some of our systems. We hope to bring our client community along with us and continue the education in the digital space. Behavioral health, it's just going to be a massive need. It's already underserved, but the amount of people in mourning, either for folks lost here locally or lost in their home countries, that's pretty significant. We see middle school youth at our primary care clinic. They're not doing so well. The Y really hammered home that connection. We really think of middle school youth as particularly vulnerable from who we've been engaged with. That loss of English language learning in person for students who've entered the school system without strong English, it's not kept pace with a normal year that would have been in person. Parents dealing with lost income, increased debt, all the burden of keeping their family. Like, what are the behavioral health options? How can we get creative there? Vaccine and primary care access are huge. I think we have seen quite a number of immigrants enter the medical system for the first time because of COVID, and either that's a test or a vaccine. But all of these are touch points with the medical system, and we do not want to lose people. We want to retain that access to primary care and as well as specialty care for folks who develop long-term COVID symptoms. So we'll be very in tune to those patients who we see, and we see the uninsured immigrant community in our primary care clinic, but we'll be very in tune and working closely with the Hopkins system in particular around monitoring long-term symptoms. How do they develop? Where is access to care? And then finally, safety. There's a few layers of safety. One, we've already heard talk to domestic violence. We're certainly concerned about issues of domestic violence, issues of human trafficking, what that has been like behind closed doors in a less in-person environment. I want to be sure that our client community doesn't lose access to humanitarian protection because of a loss in income. So for us, that's usually legal services. Can we step in and support clients to find status, to find protection? But there's also an element in safety of financial safety. So how can we get creative in a huge swath of the community who does not have standard access to the full economic landscape? Are there opportunities here for cooperative ownership of different business models and more creative avenues for financial stability? So that's a few thoughts. I'll get question number 2.
Yeah, no, that's great.
Yeah.
And I just have to call out, I think, in our Rob O'Connor, the head of our Office of IT, along with a number of our other colleagues and department heads and subcabinet members are all here today. And I want to thank you for your time. But I call out Rob because I was really struck, Matt, with the idea of the internet as a utility and thinking of it that way. It really does. We work a lot with eviction prevention and utility safety and things like that. It really puts that in an interesting frame. So thanks for putting that and all those other things out there. So a number of you, it's interesting how everybody chose to answer a very broad question. The next one's going to get very specific and ask you to kind of get down into the details. You heard the county executive talk about a number of things that the county's already doing or that we have planned or that we've been working on. You're also probably well aware of a number of initiatives that are being generated in the community, either independently or in partnership with county government. Very interested in hearing where you think there are gaps. And I want to be clear, there's 2 types of gaps we're talking about. You can address one or both. The gaps are in services themselves, and many of you have already called those out, and you can reinforce those or you can hit more. What things aren't being addressed out there that you think should be? And 2, the gaps in outreach and connection with certain populations. We can be doing really well in something, but not be connecting to a certain part of the county population, and that's going to equally cause a trouble. So the more specific and explicit you can be in this answer, the better, because we want to take this as help in developing a blueprint to get better. So Matt, I'll give it back to you, and then we'll work our way back through the other way.
Great. So I just want to emphasize I'll be responding with the perspective of serving the immigrant community, this being a community that was not eligible for nearly any of federal or state level recovery bills. So by default, there has not been an influx of cash to support loss of income. Now, the eviction prevention program at the county and a similar one in the city have both been massive for large segments of all populations, but they're not always seamless. And I think it's just always emphasizing we need systems that are accessible. Many of the landlords are not traditional landlords. They're difficult to work with, or they're absent. So how do we make sure folks who need that protection can access it? But one thing that is different in my context, and we were about 50% city serving, 40% county serving in our client base. We have seen at the city level, and I know this is going to come off as just a straight up comparison, and I want you to know I recognize much of the effort on both sides, but I think the existence of the Maryland, the Mayor's Office of Immigration Affairs has been a pretty stark difference in the amount of effort and resource mobilization that supported the immigrant community. I think it has this very clear mandate that we don't see a apple-to-apple comparison for on the county side. As a result, there's been less investment in making up that loss of cash assistance. So there's been cash assistance programs on the city side. Some have targeted food, some have targeted rent, some have targeted COVID-19 isolation, incentivizing COVID-19 isolation, and these are ongoing. Unfortunately, for our patient community, we can serve half and funnel half of them into these programs, and the other half we cannot. And often there is a family split between the county lines. It's quite a fluid line for most people who live in the region. So we do find that presents some barriers. The vaccine effort, I think the county is bigger in geography, so transit is a big issue. How do we bring vaccines in a way that's accessible? Right now, our effort serves the county, serves the city, but all of the vaccination that we're involved with is in the city. And we're starting, I think, especially as eligibility broadens, we're starting to face a real logistical challenge. Now, I'm also going to be in touch with other folks at the county next week, and this is an ongoing conversation, but transit is certainly a bigger issue in the county in terms of access. Yeah.
Great. No, they're all really important points. And I will, this is more to hear from you, but I will say this, your point on the point person around this. I know Catalina really well and what she does in that office. So there's many folks on this call that your point's very well taken and something that's been discussed. So thank you for putting that out there. All right, working our way back up. Lena, we're right back to you.
So with gaps that I find would be in the collaborative partnerships between the different agencies, the nonprofit agencies, and the resources that the county has to offer, and connecting them to the individuals that need them. A big discrepancy for me and, with the NAACP would be with funding. Once again, we can have these conversations, but, most of us are working on with no budget or shoestring budgets, in order to do the work that needs to be done. We talk about, recovery, like with the school system, having the pupil service workers be able to find these families who are no longer engaged in education, to have social workers working with families, with the mental health of students, all of that takes funding to do. And so I find that, that's a gap that's there in the services for families and students. As far as with the vaccine, I still find that there's big disproportionality between those who are receiving vaccine. I know myself I'm also a teacher. I am still on a waiting list for Baltimore County to receive a shot. My parents are over 65. They're still on a list waiting to receive a shot. Friends and family who are meet the criteria and, the first, numbers that were ready are still waiting from Baltimore County in order to receive a vaccination and have not received a call. So I don't know what the work that's being done in that area, but I find it's an extreme gap for people of color in the county. I don't know is it a lottery? Is it a pool? I don't know how people are called in order, we register on that website, what that looks like and how folks are given that access. Also, we have, with housing, affordable housing in the county. I know we've tried, many times to, have low income communities come into the county to offer residents by builders, but for one reason or another, it's always fallen through. So we have these landmark decisions that say we're going to have these many, properties that are set aside for low income, for people with disabilities. And time again, that does not happen. It's just a gap between what we say and what we actually. I have someone coming in the door. So I just find that there's we talk about those gaps. Those are the gaps. And the biggest gap is between, what we say we're going to do and the funding in order to get the work done.
Very good. Very excellent points. And some of these that come up here, even though we can't engage in a back and forth here, I think are worth reaching out to you offline and having some discussions about some of these as well. Thank you. All right, back up to Amy.
Yeah, thanks. I see two big gaps. One just kind of gap in breathing room. We have all been through a huge year-long crisis. So we have our staff that hasn't had a chance to take a break, and we have families that we're trying to move through a process, and they haven't even had a chance to kind of just process what's happened to them yesterday, let alone the whole year. So creating kind of systems of care that allow for people to be moving forward with intention, but also recognizing and respecting that human beings need to have a chance to integrate and think through and process what they're doing. I think the other thing that jumps off the page at me is the gap in probably awareness of how our services have either implicitly or explicitly participated in systemic oppression by presuming that either through program construction or fund restriction, we know what's best for families and individuals receiving the support we're giving. And I think that it requires us to step back and appreciate that sometimes we put constraints on how money can be used for flex funds or housing or other ideas of investment and sustainability. They really are constraining the individual autonomy and de-empowering folks that we're trying to actually serve. So I would say that the way to kind of address that is begin to recenter who's actually in charge of this work. And how do we maybe die to ourselves as service providers and government officials and let the folks that we're serving kind of influence and drive what we deliver rather than us trying to make our own objectives and strategic priorities.
That's very interesting. You talk about we always talk about passing down or passing along funding, but we also tend to pass down or pass along restrictions in funding too that come from different places, part of different policies. One very interesting side effect of what's going on with this health emergency has been slowly evolving more flexible funding from our federal partners, which goes back to that opportunity. But those are really excellent points we need to be thinking about, Amy. Thank you. Back up to the team of Cheryl and Mike. You can take this.
Cheryl, go ahead.
Like.
Hi, this is Cheryl. So actually, Amy, I think, was reading my notes because I think, in terms of identifying gaps, one major gap is in the data of who has a disability, right? And how many folks with disabilities belong to other minority groups. We know in general that 40% of the deaths from COVID have come from nursing facilities. And what's notable about that, it's often, sort of put in the camp of seniors. but people of all ages live in facilities based on functional need. That's disability. But what we don't know, it hasn't been tracked, are those living in the community who have disabilities and underlying health conditions that don't necessarily self-identify. But these are folks who are more at risk. And yet, as Mike said earlier, it's not even on the prioritization list in Maryland in many places. So I think that's a huge gap. And it's not just about COVID. COVID has centered it in our minds, but it's really hard to develop infrastructure around housing and transportation and all of these various systems that we've been talking about today if we don't know the population that we're dealing with. Like we don't know the struggles because we don't have a category for it. So I think a way of looking at that moving forward will be very important. But back down to the nitty and gritty, we've mentioned the housing, we've mentioned the transportation, we've mentioned a little bit the health disparities, and a piece of that is home and community-based services. When folks in nursing facilities experience a COVID outbreak and want to move out, there's a piece of that that's housing, and there's a piece of that that's transportation. The other piece of that is providing home and community-based services, the people to come in and help you bathe and dress or do meal preparation, to help you scheduling, paying bills, things like that. Those services, an additional influx of investment in the county could really, not just during COVID, but in all times, especially when an emergency situation comes up, we're better prepared to meet that need.
Yeah, and we really need to vet those programs efficiently. There are so many, frankly, if you want to talk about a pandemic, it's a pandemic out there among businesses that hire people to do in-home care at extremely low wages, $10, $11 an hour. And then they say, oh, and by the way, you're not an employee, you're a contractor. So go buy your own PPE, go take care of all your problems. And if you don't like it, don't go to work for us. That whole problem is huge. But let me talk about nursing homes again for just a second.
Sure.
We need to save people's lives, and one of the best ways to save them is to get them out of these facilities, and that means initially providing them with a telephone and Wi-Fi access in every room in these facilities so that they can communicate outside. And then we need to be able to get folks in from centers like ours, our Center for Independent Living, get folks into those facilities to help people get out and get back into the community so that they're not in dangerous situations anymore and can live. It's as Cheryl said, it's about finding a way to really declaring a county war on the prioritization. We need to prioritize that people first are put in the community. Well, nursing facilities ought to be the last alternative, as we've seen. They're very, very difficult places to manage, and they're dangerous places, and we need to get people back out in the community and that means vouchers. We need to increase, you want specifics, we need to increase the number of vouchers available. Maybe we need to categorize people with disabilities in nursing facilities as homeless, so that we can take advantage of some of those vouchers, and we can and we really need just a massive influx of funding for those vouchers to get people moved out. Our center is willing to help. We view this as one of our primary missions is to keep people in the community, living in their own homes, aging in place, aging gracefully, if you will, and not living in facilities where they have no control over their lives.
Mike and Cheryl, thank you. I appreciate the specifics tied to the sort of passionate explanation of why you got there. And we're still waiting. We've seen a tremendous amount of resources coming out around things like rental assistance, but the housing resources and others are what's coming next in infrastructure. And so I think we need to keep these things in mind as we get more guidance on what we're going to see. So thank you both. We're going to go to Michelle, and then we're going to end with Megan. And Megan, you get the pivot question coming back for our third. And then I'll warn you all ahead of time. Because we're getting closer to the 5 o'clock hour. The fourth question is really a catch-all. The fourth question is, what haven't we covered that you really want to make sure you get out there on the record while you're here with us? And so that'll take, that may not take long if you've already said everything. So we'll finish up this one more substantive question, and then kind of that catch-all of what ideas do you want to convey at the end. But Michelle, and then Megan talking about gaps.
Great. I don't know about Megan, but I'm loving being on this end of the questioning because you get to say ditto, ditto, ditto to all the amazing that was said. So I like Amy, I believe she was reading both mine and Cheryl's notes. I had those exact same things and highlighting the populations that are just super resilient, but not super present, right? They are not out there. You have to go after them and not go after them once, but twice and repeatedly. And that is our diverse ability constituents. That is our Black, Indigenous people of color. It is our seniors. So that group, I think we've done a good job of some level of outreach, but not consistent and not enough. I still want to raise the issue of the mental health challenge, which I know is pervasive. I think we all know that, and we certainly need to make sure we address those needs. And I think Lena said this, the need to have this coordinated effort amongst local municipalities, the LEAs, the for-profit, not-for-profit government agencies. I think that the greater things we saw that came out of this pandemic is how all of a sudden walls that were there for forever were quickly removed for the purpose of serving people, our communities quickly, effectively, and efficiently. And I would love to continue to see more of that help us address these needs that we know are still going to be with us for some time to come.
All right, and then ditto to Michelle's points, but I would like to also say that for the individuals and the family seeking services, I think that one thing with that gap in service that we really need to look at between the county and the nonprofits is how we can really serve as a one-stop shop together for people that they don't have to call or contact multiple places to be able to receive their services, that we have some sort of coordinated system that folks can really, if it's eviction help, if it's childcare, if it's, whatever their barrier that they need, that they can really call in, and we would have some sort of system that they know CAN has money, they know United Way has money, we would be able to serve them from a coordinated way, basically, and they didn't have to call multiple places. So I think that could be kind of a gap, because we're missing people because they're just tired of calling around. They get frustrated. So I think that that's one area that I see opportunity for us to really have a coordinated system between the nonprofits and county government to really help people not have to go all the way around for services.
With all the advancements we have, I think it's reminding us that at the end of the day, about that coordination, it's back to connecting people to people, then to services that is worth remembering.
Yep.
Okay, Megan, ready for number 3? You lead off again.
Right.
I did not put this list together. This was put together by others. I'm not picking on anybody, I swear. So we started with this really broad idea of what does recovery mean to you from your perspective. And then we went all the way down into the weeds and talked about very specific gaps. And I think I've got 5 pages of notes already. So I think we have a lot of things that have come down. The third question, and really the last substantive question, is thinking about, and I'll read it, but then explain, knowing the inequities and challenges that persisted before the pandemic. I think any number of you have mentioned that repeatedly, that we're dealing with exacerbation of issues that have gone on, not just right before the pandemic, but in some cases generational. What needs to look different in the future? What opportunities do you see to improve the outcome for all residents and their families, no matter the degree to which they were impacted by the pandemic? And it goes back to my opening comment about businesses and listening to these conversations about how businesses can build back in ways that are more nimble. And we have systems that have been exposed and deconstructed throughout this pandemic, and we have a chance to rebuild things in a way that will work better than they did in the beginning. And honestly, lift people up in ways that we weren't thinking about, maybe the way we should have beforehand. So this is the aspirational part of the question. How can we do better moving forward? You've all touched on this in different ways, so hit us with it again or add something new. But Megan, you'll kick it off.
Sure. I think one thing, as we know what the pandemic did, it shows us that money can be there. Money can come from some places when we are in, crisis. And we have to remember people have been in crisis pre-COVID pandemic. So that's one thing, is that just shows us that the money can be there. But really, I would say that what needs to be looked at in the future is the flexibility to help people with not so many restrictions. I understand why restrictions have to be there for certain grants and things, but there has to be, if we're going to really serve people to help get them out of whatever crisis they're in, we have to rethink, these grants and all these tight things that disqualify people from getting the help, and then they just never get the help. So they're always just needing something every month. So I would say that really gives us that opportunity, and also to bring the landlords to the table a different way. I think that has shown that, if we can approach this thing as a team, from the tenant, from the landlord, from whoever can help financially, what type of package can we put together for people? Obviously, and Terry, I'm gonna say all the time, affordable housing, helping people to subsidize their income for housing. I think we need to find some way to really focus around in on that. And with the funds that have been available, what can we try to stretch those funds by subsidizing things for people to help them out? Some people may not need all of their rent paid, but they just need some portions a month, because that's going to help them out. So I think this really provides an opportunity for us to look at housing and helping people in that way.
That's great. Thank you. We'll just go right to Michelle. We'll keep it going.
Great. Just to add on to Megan, I would say that the first A that comes to mind is access. We talked about that earlier. It's amazing how much became accessible during this time, from funding to support to volunteers to organizations. And we knew, like we said, it's centuries of inequities that have existed for many of us. And the health inequity issue has come in the spotlight. And obviously, I don't know about you, but I've seen more focus, and happy to see it, on racial equity than I've seen in my lifetime. My request is that this not be hurricane relief, that it stays, right? We know we need it. And if we can make it happen now, we can continue to make it happen. The lack of transportation, and then here comes this wonderful partnership with Lyft. The lack of health equity, guess what? We don't need your ID card at this point. We will still see you. We will bring a mobile unit to you. The types of behaviors that we're seeing that, would have loved to have seen, many, many years ago, that we're seeing now. My request is that they stay, and that it, again, not be like hurricane relief. And the other A that comes to mind is ask the community, right? We talk about the communities that are, have been disproportionately impacted by this. And we could do a lot of things based on what we see coming into these various entities, whether they're coming into CBOs, whether they're coming into health centers, and we can get rhetoric and even probably hardwired data from people there, but why not ask the community? Ask them what they need. I believe Amy may have said something to this effect all along, that we have to give voice to the individuals that are being impacted, instead of giving them pre-planned programming or things we think they need. Ask them what we know they need and work our best to accomplish that.
I've circled "Don't let it be hurricane relief," and I'm with your permission, I'm going to use that, and I'll send you $1 if I need to for permission. But
send the $1 to John Hoey. Send the $1 to John Hoey.
Well done. I'm gonna owe Matt $1 too for the internet as a utility idea, because I'm gonna steal that one too. I'm making a list. Michelle, thanks. Working our way back through. We're back to Michael, then Cheryl.
Sure. I was just thinking, as we were all talking, back in the 60s, when you did surveys of people and how they felt about government, 80% of people said government can deliver a good quality service. Now that number's down to about 17%. We created massive amounts of programs in the late 60s and 70s and 80s. But what we also created were massive bureaucracies where people couldn't get what they needed because of all the barriers that we created with regulations and rules. What we need is a system that allows people to break those barriers down. The Maryland Access Point and the folks at the Baltimore County Department of Aging work tirelessly to do information and referral. That staff should be 3 or 4 times its size. And they should be people who can not only take a phone call where somebody asks for a piece of information, but can also dig deeper and say, look, what can we help you get? And then how can we coordinate the fact that you actually get it, so that we build some trust back in our community and government and what it is, what it can do. Specifically, though, as I was thinking and listening to this, we still don't have a priority for psychiatric disabilities and getting vaccinations. These are vulnerable folks who need us. They need our help to get vaccinated, and they're not anywhere in the lists. We need to, I wish there were commissioners here today, because one of the things we could do long-term is stop giving waivers to builders when they want to build places that are in inaccessible areas, or when they want to build things where they build a neighborhood where there's no sidewalks. Come on, really? I mean, we have really got to make a decision that Baltimore County is going to be friendly to the aging and disability population for the next 50 to 70 years. They're only going to get bigger. We need to meet that train head on and say, no, we're going to do it the right way by really not providing those waivers. And Baltimore County also needs some visitability legislation that says when you build your house, it needs to have one accessible entrance and exit so that neighbors or friends or relatives can get in and out of the house who are in wheelchairs. It's those kind of things that really, I think, will make a huge difference in the long run. Cheryl?
This is Cheryl again, and Michelle this time was reading my notes. I think it's how do we make a county, how do we reflect the population? Well, it's to have folks who represent the population actually involved in the decision making. So I'd ask, as I have before, that people with disabilities be involved in the task forces, that partnerships with the Centers for Independent Living exist between the county, and also be encouraged between the various social service organizations and nonprofits like we have on this roundtable today. That's really how we do it, is we build trust, and it's by building awareness.
That's an excellent point. Thank you. And the hardest part about moderating this is I want to have big conversations about each one of these things you're saying, and I'm not allowed to do that. We don't have time, but I'm going to be doing some follow-up calls. This has been such a valuable exercise already. I hope everybody's getting as much from this as I am. Moving forward, we are back to Amy and then Lena.
Yeah, I can highlight and lift up. Thank you, Megan and Michelle, for what you've been saying. I agree with you about flexible funds and really engaging the folks that we're going to be serving with the funds. I would say stretch out the runway, give people more time to recover from the impact of crises in their lives, and stop expecting 90-day turnarounds. I would also say to the long-term vision is probably more important to me, and we'll take the time, the energy, the money to invest in this type of strategic thinking, collaborative partnership to decrease silos and enhance collaboration and coordination. That's not going to produce short-term, make everybody feel better wins, but it will change systems over the long term. And I think if we can enhance our tolerance for some of the work, we're going to do much better than trying to just solve whack-a-mole style.
I gave the federal government credit before, Amy, about trying to make the money more flexible. They haven't gotten the message about making it less time limited, and I'm hoping that we start to see some change in that, because that makes us make some improper decisions as well. That's another great point. We'll go Lena, and then we'll end there with Matt.
So I'm really interested in, education is really my thing with the NAACP, and relationships, and building those relationships. And I guess I'll meld 3 and 4 together, because I just really echo the sentiments that have been mentioned already, just about that, building the relationship between the county executive and the superintendent of Baltimore County Schools. I find that it's very concerning that there is this back and forth between the 2 agencies. I find that it's very disruptive, and it doesn't ultimately meet the needs of the students, and therefore families, and therefore community of Baltimore County. You're talking about educating children children are the future. And if we don't get it right, if the leaders cannot lead and lead by example, I find that, what are we really doing? And I find this a serious concern, pre-pandemic, post-pandemic, post-ransomware. I find that, we have to get on the same page to be about the business of educating students in Baltimore County. I will say, when we look at our constituents, and who they are, ensuring that we, again, are meeting the people where they are. So, your constituents who have needs may not be the ones emailing you, may not be the ones who are ringing your phone off the hook, who may not be that squeaky wheel, and so going out into the community to determine, the needs that are there, I find is going to be definitely important in finding out, what do they feel needs to be improved? It may not be what I think or what you think, because we're not in everyone's shoes. We can only give from our perspective on what we find to be important. So maybe doing those town halls, I think there was a series that was done in the beginning of his administration. He did some town halls, doing similar ones where you're actually in those communities, all over, the west side of the county, the east side of the county, the central part of the county, and just making sure that you really have an audience that reflects the community and what you're trying to reach. I would find would be something that is important, during the pandemic. But I do like the fact that there are all of these, I didn't know some of these organizations existed. And so I find, when we do these roundtables, is this a one-time only? Or are we going to set objectives? Are there, I've seen the strategic plan, do we get together to meet on these objectives to determine, well, how are we doing towards these goals? Have we met any of these objectives? We wanted to do these things, from 1920. Did we successfully do these things, or are we still working on these things? So I find that these conversations are very nice to have. We all have pie in the sky dreams and wants for what we want our communities to look like. But, again, is the actionable things that I think will make the greatest impact. And that comes with, putting all of these people together on a consistent basis and, providing, the funding and the actual resources that are needed in order to get the work done.
Thank you very much, Lena. I'm going to pause for just a second, and I'll read this later, Amy, if you want. But Amy has a commitment and she's hung in there a few extra minutes, but has to leave us. So just wanted to acknowledge her leadership and in what her organization is doing. Thanks for taking the time to be with us today. All right, so what we're going to do is it is now about 5 minutes after 5. We're going to have Matt answer the question, and then I'm not going to put folks on the spot if you don't have more to add, but I am going to open it up for a few minutes to say whatever other ideas you have, please get them out. There'll be other times, but let us know what you're thinking. And then I've got a few closing remarks, and we'll be able to end on that. But Matt, let's end this question with you. I'm scrolling through to see if we lost Matt. I think we might have.
It looks like he switched to phone, but I'm not sure if he's just unable to speak at the moment.
Okay. Well, Matt, you get to jump in line if you get back on and we can hear you. But let me do this.
You have a little accident today.
Oh, can you hear me now?
Oh,
Yes, I can hear you.
Yeah, great. So I'll be super.
Whoops.
I'm reading The Black Butterfly right now, and this conversation and what could we do. I think it's just a wonderful moment to think bigger. And there's I see the mayor of Baltimore. He's convening a steering committee on a guaranteed basic income. We're thinking about all the issues of healthcare access, the affordable housing, just access in general to things like internet. I'm excited about the big ideas that this is generating, and it's the perfect moment to keep this type of group convening and thinking big. And I'll go mute because I've got kids yelling at me. But thank you so much.
Sure, yeah. Matt. It sounds like you're dealing with life. That's a good thing,
right?
So let's do this. I'll open it up for a few minutes. I'll start with Amy's. Amy just said that as far as question number 4, she'd like to see us prioritize the function of family as the most essential component of society moving forward. Education, effective employment, safe housing, healthcare, transportation, and recreation is core. And please don't forget the people with criminal backgrounds. Leverage technology to promote transparency and collaboration. So thank her for that. And then this is the big idea time. Whatever you feel like ending on, don't wait for me to call on you. Just jump right out and let us know what you're thinking.
Well, I was serious earlier as Mike Bullis again. I was serious when I said, we need people who can jump barriers. We need people who have that scepter in their hand who can just wave a wand and say, no, we're going to move all the barriers we can to get people out of a nursing home, and all the agencies can coordinate. We can jump the line and make things happen with housing in Baltimore County. We can jump the line and make things happen with food resources, et cetera. It's building trust back in Americans with their government again, and making government a place that people want to work for and want to be part of, and we have a huge challenge ahead of us because of the credibility gap. I think people with disabilities can add a great deal to that as we look at employment opportunities, as we look at the opportunity to raise a family and live in Baltimore County. All those things depend on transportation. They depend on services, and they depend on us breaking this gap down and moving people into equality. So I'm really high on the idea that there ought to be some people knighted, if you will, to be able to break some of these barriers so that we can rebuild trust. And our center would love to help out in any way we can to make this happen for Baltimore County. We have a wonderful relationship with the folks in Baltimore County.
Great. Yeah, I've circled breaking down barriers about 10 times, and I drew a little crown next to it, Mike. So I'm not going to forget that. Anyone else?
I will just add really quickly in terms of creative idea. I talked to some of my team here, my staff, and one of the things they said for, the younger demographic, not knowing what services are out there, a real focus more on social media and how we can really access folks that way. I know we send out flyers and emails and things like that, but we're also missing a group that, the hashtag of whatever, and really push that through so people who aren't really, in the loop of some of these services may have a different way to access them.
Thank you. Great point. Other thoughts?
This is Cheryl. This is Cheryl. I would add one thing in that it was mentioned earlier, but I think it's worth mentioning again, is that COVID has brought together people who may not have known each other before, may not have collaborated together before. It has opened up technological opportunities that haven't been there in the past. Many of these things have benefited a segment of the disability community that has not been heard and seen in the past. And I'd hate for that to disappear. So as we move forward, I hope that we learn lessons from this in inclusion and diversity and bring those advances with us so that the whole picture is enhanced instead of going backwards again.
I like that a lot. Yeah, it's funny when inclusion becomes something necessary to get things done as opposed to something we talk about. There are some really deep lessons to be learned there. Thank you, Cheryl. Other thoughts or ideas?
Just had to add on to Matthew's point. That's kind of the same note I had. I too reading Dr. Brown's book, The Black Butterfly, but I totally agree that now's the time for big ideas and collaboratively. To me, the tragedy upon the tragedy would be that we come through this and we go back to who we were before this. I think we've got an opportunity to do more, greater, better together, and together includes not only the organizations that I've mentioned before, but all the way and inclusive of all of the folks that were impacted, getting their voice in how we move forward, what we've learned from this, and again, how much better we are together when we corral our thoughts, our resources, in order to advance our community. And one not so big idea, but I think would be incredibly helpful, especially as a Baltimore County parent who's has a teen in the school system, is some creative way to wrap around our children who did suffer loss, tremendous academic and other types of losses. And how do we do that? I think it's going to be an incredibly heavy lift on our teachers and administrators. We had these lovely learning centers. Deer County had some great learning centers. We did some wonderful work, thankfully, with Rosalind Johnson, who's amazing to work with. Do we keep some of these open and they serve as support centers or things of that sort so that we can help our children catch up in tandem with the actual immersion back into school? We know they're going to need more, and what's the best way to do that in a meaningful way and obviously not be a cost prohibitive way? Just one of the smaller ideas that I think may be helpful to help us get back on track, and more importantly, get our children back on track after such a tumultuous year.
Yeah, I don't think I call, the only thing I disagree, Michelle, is I don't think I call that a little thing. I think that this idea of that is huge. And I appreciate your shout out, Roz, and the work they're doing at Rec and Parks, but that's a big one as well. I think.
And Michelle, I was going to say, that's not for me, that's totally a big idea. For me, I really am interested. I didn't see that there was, an education stakeholder group similar to this for the recovery and, asking these similar types of questions, but pertaining to, the school system. And I find that might be helpful as you are planning for, monies from the federal government that come from state or, where have you, as we think about, those wraparound services that may be needed and how, thinking about what education looks like, moving forward, because we know that there were some kids who, did not fare well virtually. And we know that there are some kids who did a great job virtually, and so just moving forward, what does, is it the education system of the 60s and 70s, or are we now developing a post-pandemic, because we've now have all of these things that are brought to light and how kids learn and how they best learn, and developing in an environment where everyone can be successful. So I just wanted to, piggyback on that as a very big idea. And I would really be interested in participating in a similar group, but the focus was on rebuilding the school system post-pandemic moving forward.
My daughter's graduating from Towson High School this year. She says most of her friends are in crisis of one kind or another. Suicide is a huge issue for these kids. This has been devastating to kids. We need to do anything and everything we can to bring it together.
Thank you for following that up, Mike. Lena, it's interesting. You noted the lack of somebody on the panel. We had some scheduling problems, and then we had wanted college and grade school representation. So we're thinking about it. But I will say, you were here representing your organization, but you've done a really excellent job standing in for the educational folks as well. And a lot of others have brought those up as well. So thank you. Anything else? All right. Well, that's good. Let me say this. This I can speak, Leonard, hopefully for the subcabinet, to say these were the beginnings of these conversations, and with many of you, these have been going on for a while. I won't give a long closing, but I want to point out the obvious. I think most of you are involved in direct service work of some kind, but you didn't focus predominantly on the exact nature of those direct services. So many of you kept going back to the opportunities to change systems and the opportunities to collaborate outside of your space and to work in better partnership and better communication with the county government. I think that speaks miles to what we're really getting at here, which is rewiring how we do things and not being so hung up on the exact numbers of who's getting the housing and how we're doing this, and just being more organic and blending it together. That's my observation, but I think it's a powerful one that I've seen. And I want to thank you for reminding us all about that. With that, Leonard, I don't know, as the chair of the subcommittee, if you've got anything you want to end on. My head's full of, my notebook's full, my head's full. There's so much here to think about and process, but we will be back out in touch and using this information, hopefully to drive real actions as part of the recovery. So thank you so much for your time and the work you're doing out there in the communities with your clients and constituents. Leonard, did you want to end us up?
Yeah, I'll just quickly say that
Terry, thank you so much for leading this discussion, and for all of you that participated. I just echo what Terry said. Great ideas. This is a great start to the conversation. Terry mentioned at the very beginning that this is the second conversation that we have. The first one was focused on the business community. You had this conversation today, and tomorrow we'll be talking squarely about the workforce and the issues that people have within the workplace. But in and of itself, this is the beginning of our work on recovery. So we look forward to continuing the dialogue and look forward to touching base with each of you as we move forward. So thank you very much.
Very good. Again,
I
thank you, everyone.
I want to thank Terry. I wouldn't have been able to keep my mouth shut as you did so well. So thank you so much for really an excellent moderation experience.
Yes. Thank you.
The
Terry.
ones that know me on this call are laughing already about this. But thank you, Mike. It was a pleasure meeting you. And
Pleasure as well.
good night, all.
Good night.
Thank you.
All right, thank you very much. Take good care, all.